I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, Raw and Unfiltered. And if you're wondering about how to navigate the complexity of the journey of your own health, stop right there because this podcast is designed specifically to help you understand the nuances of what is out there for you. Because the big challenge, for most of us is that when we don't know what we don't know, that makes all the difference. Then we're stuck, we're confused. And then there's a lot of pain and uncertainty in all of that. And this is specifically important in the world of chiropractic, specifically in the world of our structural part of the body, is our skeleton, our joints, our muscles, and all of that. And of course, in the world of injury. And so there's a lot of confusion in that field, but because there are pioneers out there that are absolutely dedicated to serve you at the highest level with the latest of technologies and science and insights, this is why this podcast is really great, because we get to have the conversations that you don't normally have to lead you in the right path forward. And then if there's somebody that that has some sort of structural challenge, maybe it's after an accident, ask them to, or invite them to watch this show and our other show with my both incredible guests so that they can understand what it is that they need to do for themselves. So what am I really talking about? Well, here's the truth. Our health is very confusing these days, but other truth is that we no longer have an excuse to be sick, because there are people like my incredible guests here today that can guide you, and there's a lot of information out there, and there's technologies that can serve you at the highest level. The problem is most people are not aware of it. So what do we do here is we do a short role play of about 6 to 8 minutes, where one of my guests will present with a particular problem and the other will act as the guide. And the purpose here is that you can potentially witness yourself or someone that you care about with this particular problem, and then lead them to watch this podcast so that they now know what it is that they can do. Or if that's you, my hope is that you leave with a particular insight and an action step that you can then take to then uncover how you can optimize your health. So it's about a 6-minute role play. We'll do that after my two guests introduce themselves. And then after that, what we'll do is we'll unpack what we talked about, what you saw, what you witnessed perhaps in yourself, so that you get the insights and the action steps that you can take. So want to welcome Evan. Thank you so much. Please, brief introduction about yourself. And my request is don't hold anything back. And I'm going to ask the same thing of Curtis, because you guys are amazing. And I really want people to know how amazing you guys are and the incredible work that you do. Evan.
Well, thank you so much for having me on. My name is Dr. Evan Katz. I'm a chiropractor in Boulder, Colorado with my wife, Dr. Shauna. Been in practice 24 years. In that time, had the opportunity and pleasure to help a lot of patients. We really focus on the structure and stability of the spine, and we've published papers published in the Journal of Brain Circulation, where we show that abnormal neck curves can decrease blood flow to the brain. We published one of the largest biomechanical papers looking at injured necks after crashes compared to the asymptomatic population. Published papers with one of the guests on here, Dr. Curtis, with the brain flow as well as improving spondies in the cervical spine,
right.
And others. I teach a lot for other institutions. I have a consulting website with other docs full of research and other providers that are on there called professionalintegrated.com. And I love what I do and practice.
Great. Thank you, Evan. Curtis?
My name is Curtis Fedorchuk. I practice just north of Atlanta, Georgia, and I've been in practice 22 years. And similar to Dr. Katz, I published a lot of research. Again, he mentioned the papers that we published together. And I've done, myself and my colleague Doug Lightstone in the office, we've published a lot of firsts in the profession, as has Dr. Katz. One in particular that I'm most proud of is in 2017, we published the first documented case ever of a grade 2 spondylolisthesis in the lumbar spine. We reversed it in a 69-year-old woman. And then just recently, this is 7 years later, we have years follow-up on her, and we just published that in the Journal of Clinical Medicine about a week ago on a case series of actually more than one patient. But so early on, we were, years ago when this happened, 2017, most of what we were met with was not excitement and, well, wow, this is great, but more like ridicule, like, oh, it's not going to hold. don't bother. But now after 500 plus cases, we're now starting to really show the effects of our work long term, that we're actually able to fix majority of these problems for a fraction of the cost of what, the surgical procedure does. So pretty proud of that. And but yeah, we have a busy practice and we see all kinds of conditions. But again, as of late, that is kind of our claim to fame, if you will.
Right. And you should be really proud of that because, as a surgeon, my preference is, what are the non-surgical approaches that potentially can benefit the patient at a much higher level. Clearly, you guys are leading the way to help people rebalance these structural abnormalities that are due to all sorts of problems, including accidents. And the truth of the matter is that when we can correct those in the manner that you do it in a very, very precise way, it's going to benefit people at a much higher level on so many different fronts, including the financial one, but also the longevity. Because once you start operating, that changes everything permanently. And the truth of the matter is that when we look at our overall health, what is oftentimes completely ignored is the structural aspect. And so I'm so grateful to you chiropractors, particularly the kind that you guys are, with so much more precision in leading us to understand that structural part is so critical for our health. And it's one thing that we cannot any longer ignore. So let's go into that role play. So Evan, you've got a problem, and this will be a dialogue between Dr. Evan and Dr. Curtis for about 6 minutes to some form of resolution. And I invite the listener and the viewer to recognize, where you might be experiencing this as well.
All right, you ready here?
Ready.
Hey there. I've been seeing some chiropractors for some back pain, and they told me I have something. I think it's called a spondy or spandy. Is that correct?
Yeah, it's like, did they show you like a slippage of the vertebrae? It's stacked on top of each other and it's like slid forward or backwards?
Yeah. But I saw two different chiropractors. One said that if they just adjust my atlas, it'll help it.
Oh
And I
wow.
tried
So
that.
did you get treatment from that?
I did.
Did it work? Did they do it before and after?
They did not do an after X-ray.
Oh God. So did they say they thought it was better, or how are they going to tell you it was back in, I guess?
I kind of asked that too, and they were saying, well, if you feel better, then maybe it's in, but
God,
I
do
still
you
have
feel
some
better? Do you
ongoing
feel
pain.
better? I mean, that'd be great. Do you feel better?
Not really. I mean, I still have some discomfort and pain.
I gotcha. Okay. Because I mean, reality is obviously I'd want you to feel better, and I'm sure your provider that individual wants to make you feel better. But as far as I'll put it to you this way. I always tell other patients, kind of like yourself, I'm going to talk about a 3-story house. If you have a foundation problem, the foundation of your house is shifted, do you think by working on adjusting the attic of your home, do you think that'll somehow trickle down and change the foundation of your house?
No, and that's one of the reasons I stopped and I went to another chiropractor who took a different approach.
And what they do?
They were laying me on both sides and rolling it and up my spine.
Gotcha. So if it is a spondy, and in fact, so there's something in your spine. We'll look at your imaging right away, but if you have a bone that's, say, backwards, if they're rolling you on your side and trying to push it forwards, I could see how that could offer some value. But if something's forward and they're pushing it more forward, do you think that's doing you a service?
No, I don't know. Yeah, it didn't really make sense to me. I wasn't sure if there is anything that can be done.
There actually is, and I will actually show you that. I do want to shift back to the first guy you saw, just to clarify my house analogy. Something that can happen, for example, is if you have a hot water tank in your attic and it blows, what floors are affected?
Going down.
All of them, right?
Yep.
But from the water damage. So neurologically, I say, when you have upper cervical problems, can it neurologically give you symptoms? Absolutely, all the way down to your toes. But to fix a structural problem, to fix the foundation of your house, you physically have to fix the foundation, right?
Right.
So again, not negating one or the other, but to say structurally you can fix something up here that'll structurally fix something down there. I've never seen it. out of hundreds of cases. I mean, I don't practice that way, but I always ask practitioners whenever someone says that someone said they could fix them, our question to them is tell them to show you their best three. Because everyone has their best, right? They should have them ready and available, on their phone. And unfortunately, what happens most of the time, and it just happened literally 2 days ago, when someone said they had fixed literally 3,000 of these, we said, "Oh, wow, well, get them to show you their best three." The answer was, "We can't find them."
All
You're like,
3,000.
"Oh, so I'm going to show you, I can show you hundreds." So we'll look at your spine first. We'll assess how much it's actually slipped. And then we're going to do something called a stress view or an x-ray or a correction potential. And what that means is we're going to wheel in a table in front of our x-ray machine, and we're going to place you on it. And then we're going to move the table as such, and it doesn't, to whatever it takes to get your bone to slide back into place is what we're going to do, and take a picture. And then we're going to record the measurements that table has done. So then the next time we lay you on it, we're going to do the exact same thing, and we know it's going to slide back into place. Now, here's the thing. There is a chance, and it doesn't happen often, but there is a chance it will not move. In other words, I can pull the table. If I can't, typically by the fifth film, if I can't get it to pull back into place, probably I can't help you in that structural manner. But again, that's happened so rarely. I can
So,
count on my fingers how many times that's happened in the last few years, even on extreme cases. But
so why, as a patient, did someone tell me in your own profession, because you're a chiropractor, right?
yes,
Because the other two I went to were chiropractors. Why did one say it's my upper neck, and then another didn't mention any of this or even do an flexion extension view?
I can't, I mean, I don't know how long they've been practiced. I don't know where they went to school. I can't speak intelligently as to why, but typically some people, I even worked with a guy for years. He was a great guy, cared about people, but he got complacent in his education, right? And didn't look to see if there was anything out there. And unfortunately, I will tell you is that even though we've published this paper and it's out there, even when people read it, they're still in disbelief, which is so oftentimes it's, either they don't know how or they don't want to look it up, or, it's literally that, they're lackadaisical would be my word for it.
Okay, that makes sense.
Any other questions?
No, I think that answered it.
Okay.
Hey,
Go ahead.
no, go ahead, Curtis.
I was going to tell you, I don't know if you know this, coming to our office, we're not the cheapest. We're probably the most expensive. You will be here a long time, and we're very serious about you keeping up your care. And the reason that is because we get consistent, amazing results. And I say amazing because very little, if ever, have we shown that when we actually get that vertebrae back into place on the stress view, I don't think it's ever not gotten better, even if it's halfway. So that's a good thing for you to know, is that as you're laying there and you're here like an hour because your time is valuable, so you're gonna be here 3 hours a week, provided we can help you, and you're spending this money, the payoff is such that when I take a post x-ray, you're going to see change. And the good news is we just published a paper showing it actually stays in place years later.
That's awesome.
Yeah.
So that's a great wrap. Well, let's start off with Evan first. What was that all about for you? Give us context.
Well, I know Curtis has really led the charge in spondies, something I know I need to continue to learn more from him and what he's done and published. And it is something I think that our profession sees a lot of. And we all say that we can help because I think symptomatically there's things that we could do to help, but there hasn't been anything to show that, well, can it be fixed? And I know we see that often, and in our practice, hey, went to a chiropractor, said a spondy, they're adjusting in all these different ways. And it's like, well, has there ever been anything to show with any form of consistency that it actually changes? And I think that's one of the things that Curtis has really been working on to figure out and to show not just the patient's subjective complaints are improved, but that objectively there's an actual, like a true bone is going back into place.
Right.
And I know it ruffles his feathers, especially since he's putting on his work when, like I know I can get under his skin, like, hey, someone just saw, 10 spawnies today, say that they fix them all the time. And, it's like,
Right.
well, let's see the posts. Let's see what it is. And no one can ever reproduce it. They lost all 3,000.
Right. That did just happen
Right.
a few days ago. Yeah.
Curtis, give us context. What was that all about for you?
Pretty much the same as Evan said, is that and again, I didn't set out to do this. It just literally fell in my lap, and just having done it again hundreds and hundreds of times, I realized like, wow, I'm actually onto something, and I keep seeing more of them. But again, I want to be able to pass this on to my colleagues because again,
Right.
it can be done, and it's true. There are so many people that have this all over the US. I believe the prevalence on it is it's 25 to 30% have at least a grade 1. I mean, so it's pretty high. And then and we have the data on that too, like on about 2,500 subjects. And the assumption is, and we even hear this, Evan, the other day, someone said about spondies, they said it's from tight psoas.
Yeah,
I'm
you hear
like,
stuff
is
like
it?
that too.
It's
Yeah.
just the psoas muscle yanked my bone out of place. I'm like, well, so now we have to do a study on that. As Dr.
Right.
Doug said, he
Yeah.
goes, we're going to do a study on tight psoas to see if they have spondies, to see the correlation. So often many of our ideas, Bart, come from people just saying stuff and we're like, how do you know that's true? But they just keep promoting it, you know?
Right.
So yeah, I want to get better at what we do. I want to educate other practitioners so they can help them and save these people from having long-term problems.
Yeah, rather than going down that rabbit hole as to why things aren't working the way they're supposed to. I mean, if we look back in history and medicine, the vitamin C took them 40 or 50 years before it became accepted. Same thing with
Right. Yeah.
sterilization. And so there's so much inertia. And that's part of one of the things that I'm looking to help our colleagues out there to begin to adopt a different mindset towards learning new things in different ways rather than sticking with the old ways. And there's a reason behind that, and I'm not going to go into any kind of conversation with that. But the fact of the matter remains is that it takes people like you both that are showing us, yes, there is a better way. And of course, this podcast is curating and educating the consumer out there that yes, there's also a better way. And so in today's world, with so much information out there, so much credible information out there, the consumer has to filter out the nonsense and then go back to the doctor and say, well, hold on a second. These guys are doing something much better. Can you just check it out or at least guide me to as to where I can go? So this is the purpose of this podcast, by the way, is to begin to help the consumer understand that, it's also their responsibility to understand that, doctors don't have all the answers. And if they're not getting the results, guess what? Somebody is. And so it's a
Yeah.
matter of finding out. So I want to give the mic back to both of you. What's present? What else do you want people to understand and be aware of in all of this? Whatever comes to mind.
Evan, you want to go ahead?
You go ahead.
Just I think my Evan and I talk about this a lot, but I'll say this. And I hope the right people are listening, is that it's unfortunate that this material, it's actually a crime that it's not offered in all chiropractic universities because we have the most research. And I say we, I mean the technique itself. It has about 300 papers, infinitesimally more than any other. It doesn't mean it's better per se, but it should be included. And the fact that it's not, if I was a student going through school and I found out that this was available after the fact, I'd feel very is it let down? What would be the word? Misled, right, Dr. Evan?
I would say disappointed.
Disappointed at the very least, because it's been available for years.
Right.
And I taught it actually there's 3 universities that offer it, but why it's not in every single school, there's probably some really smart students that are coming out of university, these schools that were never exposed to this stuff, that would even advance the profession more than Evan and I are trying to do. I mean, I consider myself a grinder. Like, I'm just a hard worker. You know what I mean? But I know there's probably some brilliant people out there that could come up with ideas, but I just think it is just absolutely ridiculous at this point that it's not offered in all the chiropractic schools.
Evan?
Yeah, I think I don't understand how I don't want to use the word debatable, but in our profession, how we talk about subluxations and how that term is the basis of our profession, but no one can really even agree on what that means or how to identify it or how to know that it's removed. And when you look at what the work has done with CVP or what Curtis has done and others, we're showing what is normal and what's not. And it's not just chiropractors. This is, and I say this every time I present. I'm like, look, our profession is arguing what a normal curve is. And while we're arguing, the surgeons are publishing on it on, hey, when we have to fuse someone, we're trying to fuse them in a better lordosis because it gives better outcomes.
Yeah.
And we're the only spine profession that this is our basis, but yet we argue it. And it's just, it's frustrating, and that's where I think, the amount of chiropractors that I know and talk to is unfortunately a lot smaller than I want it to be, because I talked to some chiropractors. I'm like, you're in the same profession as me, and I'm arguing with you about that. Like, this is it's wild. And I have my own philosophy on why that is. But yeah, I just find it's
just hard. It's a shame for the public, because then if more knew about this, there'd be more awareness of it, and then better outcomes would be, available to people.
yeah.
No, that's for sure. But I mean, again, you guys are leading the way, and I have my own philosophy on it, but in a brief way, or brief perspective, and that is that you guys have spent so many years studying, and you're committed to a certain path, and it's not always an easy thing to change because there's a lot of forces out there. Not an excuse for by any means, but that's why it's important, for all of us to begin to work together and have much more of an open mind and a new type of responsibility to basically accept the fact that, we don't know everything. And when something isn't working, and we have to get the data for that, by the way, not just symptomatically, but we have to get the data and then be honest and say, okay, it isn't working, and then we need to try something else. And I think there's a big fear nowadays to be, found wrong. There's all these liability issues, all these legal issues, all sorts of things. And then you got insurance companies dictating what you can and cannot do. And for that matter, I mean, truth be told, and that is that, of all the professions out there, right? So that includes, medical and chiropractic. Reimbursements are going down every single year. And last year in 2023, Medicare reimbursement dropped by another 8.3%. Now, mind you, inflation increases, minimum wage increases in all other places,
Right.
but docs are getting paid less. And so many docs reach a point where it's not sustainable. They can't keep it up. And quite frankly, I think that's kind of like the plan, right? So, but rather than going that rabbit hole, it's still not an excuse. But at the end of the day, the purpose of what it is that I'm doing is bringing people like you on a platform where we can have honest conversations, and then people will have to decide for themselves. They may disagree with us, and that's fine. They may be triggered or offended by any of this, but the whole purpose is to have these kinds of conversations. And whenever we do get triggered, or whenever we are frustrated, or whenever there is a challenge, that's that opportunity to grow and find a better path for all of us. And so rather than ignoring it, or rather than just saying that it's not true, what is the relevant truth? And for that, and the highest service to all the people that we can take care of, which is exactly what you guys are doing. As we wrap it up, any final words from either of you, and then we'll just want to hear how we get a hold of you as well. So we'll start off with Evan.
No, I think this was really great. Really thankful that you asked me to be on, and I had a lot of fun. Yeah, look forward to having more conversations with you both.
Totally. And how do people get a hold of you, Evan?
They can find me on Katz Chiropractic. I'm in Boulder, Colorado. Our numbers are on there. I do have a website also for a lot of docs, like consulting, and my info's on there called professionalintegrated.com. And just reach out to me anyway. There's, my contact is all over there. Reach out. I'd love to talk to you or help you. And if I can't help you, try to find you someone that can.
Great. Exactly what I do. You're amazing, Evan. Curtis?
Gotcha.
No, just again, very grateful to be on here. I love what you said about, wanting to, progress and move forward and, again, get better at what we do. So that's always what we're striving to do. Never satisfied with where we are. And, if people want to get a hold of us, my website's betterhealthbydesign.com. I'll say this for, Evan too. If you go to pubmed.gov, the index of the National Library of Medicine, you can type in our names. You can see the papers that we published and our colleagues. It's a really good reading. Maybe for the average listener, yeah, they're not going to want to read like a 20-page manuscript. But if there's health care practitioners out there, different disciplines want to see the work we've done, there's some pretty awesome papers on there to look up. And that's it. Thank you again for having us. Really appreciate it.
Yeah.
No, I
very much.
really appreciate you. And these are the conversations that we're wanting to have, just to open up the opportunity for people to discover what else is out there. And, we're not always going to get it right. That's the whole purpose of the profession that we're in, as you alluded to before, when something doesn't work and they realize, okay, what's really happening here? And then doing the investigative work, which is what you guys are doing at the highest level, and being an example for the rest of us. And my hope is actually to bring more people like yourself on this platform, and even with more individuals, and have an open-ended conversation for perhaps a longer show, because we need to start having those conversations, and we need to have those real conversations, not being censored, not being criticized, not being canceled, but just having that open dialogue, and to understand, okay, what's a better pathway forward, at least, for specific situations, and learning, always learning, how to be so much better. And clearly that's what you guys are in for. And I am especially grateful to have had this conversation with both of you today. So thank you for that.
Oh, my
Thank you.
pleasure. My honor.
As we wrap it up, my name is Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. Hopefully you got triggered, whether you are a chiropractor or not, and think, well, no, this is a lot of BS. And BS, by the way, is an acronym for belief systems. Maybe your belief systems need some changing, and that is how we make progress, when we get challenged. And it may hurt a little bit, but that's where, we get to grow in the best way. So thank you so much, and we will be back.
Thank you.
Thank you.
All right. Well, thank you so much for having me on.
You're welcome.
Thanks, Bart.
Yeah.